Heat and poor air quality, of course, is a bad combination, and not just for vulnerable groups like children and the elderly.
Gordon Severson has some tips for everyone to keep in mind over the next few days. Gordon?
Yeah, if you don't have air conditioning, you can always go to the pool or to the beach, like the beach here at Medicine Lake. You can see behind me here, there are a few people out this afternoon, but you also have other options like dozens of cooling centers across the Twin Cities. At the Salvation Army in Brooklyn Park, Captain TJ Simmons is getting ready for a hot week.
It is brutal.
The site is one of 7 cooling centers in the Twin Cities, a place people can go if they need a break from the heat.
Sweaty, and not just in the face, but red and those kind of things.
They're ready with AC and fans and plenty of water.
I think oftentimes people underestimate really how much water they really should be having.
Over at Allina Health, doctors are also getting ready.
This is not going to be a good week.
Dr. Andrew Steen is a pulmonary specialist. He says it's been a tough summer for many of his patients with all the wildfire smoke from Canada. And this week could get even worse.
The hotter it gets, the harder it is to breathe for some people. There's less air. I mean, the air just becomes less dense and there's less air. And then you add just the discomfort of heat as well, and then the discomfort of smoke.
He says heat and poor air quality can be a tough combo for many of his patients, but humidity can be an even bigger factor.
Which makes air just more viscous, harder to move in and out, which even healthy people feel. On a hot, humid day, you just know it takes more work to move the air in and out.
At Mercy Hospital, they're already seeing patients in the emergency room.
Yeah, already this morning, absolutely.
Dr. Peter Curry says they mostly see heat exhaustion, which is more mild, but occasionally they'll see a patient with heat stroke who needs emergency help right away.
The distinguishing factor is that heat stroke has altered mental status, so that the patient or the person might be confused or not interacting.
Doctors say the elderly and children will be the most affected by this combination of heat and air quality this week, so if you can, check on them often and give them plenty of water. And doctors say heat can have a compounding effect on our body. If you're not getting enough rest and hydration, the longer this heat goes on, the more it can wear down on our bodies. So again, the best way to prevent this and kind of prepare your body for the heat this week is to drink a lot of water. Back to you.
All right. Thank you, Gordon. We also have a list of cooling centers and the warning signs of heat stroke and exhaustion. You can just text the word heat to the number on your screen, and we will send you back a link with that information.